now assessing the worm. Oh, I gotta do her vitals. Hold on. Here's her vital signs. Okay. Nothing. Okay.
Okay, so before entering the patient's room, I've assessed the charts already for their gender, age, and ethnicity. I've also checked for their mobility. My patient is able to sit and stand, so I'm not bringing anything extra into the room for my assessment. So I open the door, knock, open the door, enter, and then I'll close the door for privacy. I'll put your patient. Hi, I'm Chloe. I'm going to be your nurse today. I'm going to wash my hands, put gloves on. I'm going to do a head-to-toe assessment today. Is that okay with you?
Yes.
Okay, perfect. So before we begin or anything, do you have to use the restroom? Do you need to void or anything?
No.
No? Okay. So I've already assessed the vital signs. Her blood pressure is 108/66. Heart rate is 84. Her respirations are 19. Her temp is 98.2. Her O2 saturation is 98%. She's on room air, and she says she does not have any pain right now. All right. All right. So can you tell me your name and date of birth, please?
Cassie Wolf, 51386.
Okay, perfect. Do you know where you're at today?
State Tech.
Do you know why you're here?
School.
All right. Do you know who our president is?
Donald Trump.
And do you know the date?
September 12th.
Perfect. So my patient is alert and orientated ×4. Her speech is clear, and we're gonna start with the assessment now. All right. So if you can just look ahead, I'm gonna check your eyes. All right. Good. So our pupils are equal and active. Now, can you look up for me, please? The conjunctiva is pink and moist, and the sclera is white and clear, so that's all good. And now can you raise your head up? All right, and then can you look over this way? Okay. And now the other way? All right, so there's no drainage from her nose or ears, and all of them are good. Now can you open your mouth for me, please? All right, there's no lesions or irregular color or pus or sores, and there's no missing teeth. Do you wear dentures?
No.
Do you wear partials?
No.
All right. Can you smile for me, please? Can you raise your eyebrows? Can you frown? Can you stick your tongue out? Can you wiggle it side to side? All right, so face is symmetrical. The skin is appropriate color for ethnicity. There's no lesions or bruisings. Okay, now we're gonna do some range of motion. Can you touch your ear to your shoulder, both sides? Can you turn your head left or right? And then go back and touch your chin. Perfect, all right. And now I'm gonna check your neck for your jugular vein distension. I don't see any, so we're all doing good there. Are you in any pain or anything right now?
No.
No? Okay. So now I'm going to move to your chest. I'm gonna check for symmetry. I'm gonna pull your gown down just a little bit. Her chest is symmetrical. There's no redness or lesions anywhere. I'm gonna check for skin turgor. Skin turgor is good. It's less than 3 seconds. So now I'm gonna start listening to your heart sounds. Is that okay? Right. Do you have a pacemaker or
No.
anything? Okay. All right. This is your aortic, pulmonic. I'm gonna bring this down just a little bit. Your tricuspid. And your mitral. Alright, so heart sounds are steady and no I didn't hear any irregular sounds. And then now I'm going to check your radial pulse. Alright, and I would have listened to the apical pulse for a full minute and then I will listen to her radial pulse for a full minute as well, and then check for a pulse deficit, which there was none. And then I'm gonna check both of them. Alright, and radial pulses are bilateral and equal. Now I'm gonna listen to your lung sounds. Is that alright? Have you had any trouble breathing, wheezing, coughing, sputum?
No.
No? Okay. Alright, so now just take a deep breath for me. Everything is sounding good so far. Are you still feeling all right?
Mm-hmm.
All right, now I'm going to sit you up. I'm going to listen to your lung sounds on your back. So lung sounds are strong in all quadrants. I didn't hear any irregular lung sounds. All was good. Okay, so now I'm gonna move to your abdomen. I'm gonna check your stomach out. Are you in any pain or discomfort right now?
No.
Any nausea or anything? Can you tell me when your last bowel movement was?
Last night.
Okay. Have you voided yet today? Okay. All right, so I'm gonna listen to your bowel sounds right first. Bowel sounds are present and active in all quadrants. Now I'm gonna push on your stomach a little bit. Let me know if you feel any pain. Feeling okay still? Any pain? All right. Now I assessed the stomach before doing that. There was no distension, no masses. After palpating the stomach, I did not feel any masses. So that's all good. The skin looks good. There's no lesions or bruising there. So I'm going to pull this back down for you. Right. So now we're going to go to your upper extremities, and I've already assessed the body. There's no tubes or wounds that I need to assess or clean. If she did have anything, I would clean them appropriately and make sure there's no infections. So first I'm going to assess the skin on the arm. Skin color is appropriate for ethnicity. Her skin is warm to touch, so that's good. There's no lesions or bruising. I'll check the hand. There's no edema. Is there any pain in your hands? No. Okay. Nail beds are appropriate color. And capillary refill is less than 3 seconds. So that's good. I'm gonna check over here. Appropriate skin color, no lesions or bruising over here, no edema on the hands, and capillary refill is good on that hand as well. Okay, so now we're going to do some range of motion. Make sure your arm is all loose. Can you raise your hand straight up for me, please? Okay, back down. Can you go out to the side for me? Good. Back down, and then flex and extend. Is there any pain with that? No? Okay, perfect. And skin turgor was good on the arm too, less than 3 seconds. All right, and now I'm gonna check your radial pulses again. All right, pulses are still bilateral and equal, and now I'm gonna test your strength. Can you? Perfect, all right. Strength is good and bilateral. All right, so now I'm gonna go to your lower extremities. Are you still feeling okay? No pain or anything? All right. So I'm gonna assess the lower legs for the color, no lesions. The skin temperature is warm to touch, so that's good. There's no irregular coloration of the legs. I'm gonna check her pedal pulse now. Pedal pulse is bilateral and strong. All right. Now can you push against my hands? Good. And now pull up. Good. All right. And color on the feet is good. Nail beds are good. Good color. Capillary refill is less than 3 seconds, so good there. I'm gonna check the bottom of your feet. There's no bed sores or anything. And now I'm gonna do some range of motion. Good. And out. Any pain with that? Up. Good. And out. All right. All right, so I think that is everything for my physical assessment, or head to toe assessment. Do you have any questions or concerns? No? Okay. I'm gonna lower you down then. Do you need to use the restroom or anything before I leave? Okay, perfect. Here's your call light. And then just let me know if you need, just press your call light if you need me to come back in. And then I would take my gloves off, wash my hands. I would document all my assessment stuff, and